Well, our bones, very important. They help us sit and stand and help to protect our organs. But all too often, people don't take good care of them. In today's Medical Monday, we're going to talk about key ways to take control of your bone health. Joining us this morning is Dr. Kyla Lee. Good morning, doctor. Thank you so much for getting up with us.
Good morning, Amy.
Good morning. Who is at most risk for weak bones?
Well, let me talk to you about risk. There are risks that we can control and risks that we can't control. The risks that we can control include low calcium, tobacco use, low exercise, excessive alcohol, or not enough vitamin D. The ones we can't control are being a woman, especially if you're Asian or white, being postmenopausal, having a family history of osteoporosis, or medical issues such as needing to use long-term steroids, thyroid problems, or a gastric bypass surgery. Those are really important to bone health.
So if you are in one of those risk categories that you can't control, what are your options?
Well, I think that we can make a big difference to our own bone health by looking at supplements such as calcium. You need about 1,000 to 1,500 a day. You can get some of that in yogurt or calcium-fortified orange juice, but definitely supplements. New recommendations say we need 800 to 1,000 units a day and some sunlight to keep our bones healthy, but you wouldn't know that. You'd need to ask for a blood level of your vitamin D level from your doctor. Exercise, huge. We need to exercise 30 minutes, walking at least 3 times a week. A recent study of postmenopausal women showed that those who exercised greater than 4 hours a week had 40% less hip fractures than those who exercised less than 1 hour a week. That's powerful.
It seems like this is another one of those circumstances where suddenly we don't realize that we've neglected our bones in this case until we're older, when a lot of the damage is done. What should we be doing now? I know it seems like diet and exercise are basically the key to healthy living in general.
It does. I mean, I think we have to look at bigger risks too. This supplementation matters when you're young. Vitamin D matters when you're young. But there is an important connection to menopause. Bones are always building and remodeling. There are cells in our bones that build and cells that destroy. Estrogens help keep our bones healthy. So at menopause, when the estrogens drop, this really throws off the balance. And this is really when we have to punch it up with the calcium, vitamin D, and exercise.
So if you are an older woman, per se, and you're learning that your bone strength is down, you can possibly stop or even reverse that damage?
It's easier if you build right from the beginning, but you can decrease the amount you lose or improve your bone quality. In order to check on that, you really need a bone density that looks at normal bone versus thin bones called osteopenia versus very thin bones called osteoporosis. And a bone density is a painless ultrasound, takes about 10 minutes. It's a picture of the hip or spine, and we recommend that at menopause or every 2 years unless you're in a high-risk group.
Now, is that something that when you go in for your yearly checkup that your doctor can order for you, or is it something that you specifically need to ask for?
I think most doctors will be thinking about it, but younger people who end up with fractures, wrist fractures, they need to be thinking about asking for one as well.
All right, so now is the time to think about your bones.
It is.
All right, Dr. Lee, thank you so much for joining us with some interesting information, something to think about as you pack your lunch this morning. Thank you so much.
Thank you.
All right.